All right, so first we're going to demonstrate the concept of minimal to no restraint. In these cases, this is something we'll use for a dog demonstrating very low levels of fear, anxiety, and stress. They're feeling comfortable, their body language says they're relaxed, and often the more restraint we do to them, the more stressed out they get. And so we're going to take advantage of this dog's positive emotional state and promote it through minimal restraint. And often utilizing food makes that very, very helpful. So I'll have my technician Chelsea please put some cheese on our little wall here. So utilizing walls are very helpful when you don't have a third hand to provide food for counter conditioning for your patients. And so in this case, Chelsea's just having a very loose hold on the leash. You'll note her hand placement though. So she started by first looping that leash ring over her thumb and then gathering the leash in her hand. Notice what she's not doing is she is not wrapping it around her fingers. You never want to be in a situation where a dog suddenly pulls and your hand is stuck in that leash. So super important that you have a quick release if needed. She's also got herself ready with that elbow braced if she needs to either put her arm out forward for more restraint or pull the dog away. So for situations where we need just a little more level of restraint, either because the procedure we need to do is a tad more uncomfortable, or we just have a little bit inkling that our fear, anxiety, and stress levels may be more elevated than a dog who's completely relaxed. And we just want to make sure that if we need to quickly control the head of our patient, that we can. So what Chelsea can do is if we have our patient standing, let's say I need to do a procedure on the rear end of the dog here. And so Chelsea will encourage our patient to come forward. So notice that her fingers are gently placed underneath the collar and her fingers are facing the same direction that she is so that she can keep her eye on me and know what I'm doing and when I'm touching the dog. And then if needed to, if this dog were to suddenly try to whip around and look at what I'm doing, she could very easily guide his head away from me if needed. So our approach to restraint for dogs has changed and evolved an awful lot over the past 10 to 15 years. It used to be that it was very automatic to immediately put a dog into full restraint, bear hug, hold them tight, get the job done as quickly as possible. As we've recognized the emotional distress that we put our canine patients through with that type of one-size-fits-all full restraint, we've sort of changed a little bit. And instead of this one-size-fits-all approach for every procedure, we really base it and make changes according to how our patient is feeling, based on their size, their temperament, and what procedure we need to get done that day. So for a dog that we may need in a standing position for something I might need to examine or do to the front of the dog's face, whether it's looking at an ear, looking at an eye, you'll notice that Chelsea has the same collar hold that we showed earlier, but her fingers are facing the same direction that she is. That way she's not getting tangled, and that also she can quickly lock her elbow and push that dog's head away from her if needed. So notice how she has her knee that's closer to the dog is elevated while the other one is down. So should she need to, she can brace that elbow on her knee and straighten her elbow and lock it. And that would then prevent the dog from being able to come at her with its mouth. The other nice thing about it is that should the dog be upset with what I'm doing with his face, his ears, his eyes, hi sweetheart, she can very quickly pull him away from me and keep me safe. So for most of our patients, we take a less is more approach, which means we do less restraint, more counter conditioning, typically through food that is delicious, palatable, lickable, so that they maintain that positive emotional state. And often we can get away with an awful lot without hardly any restraint. In some cases, it's no restraint. Now, for most of our patients, if we don't know them well, we do need some level of safety by utilizing minimal restraint. For other patients, we may need a safer hold. So we may utilize things like collar holds or short leash restraint. Or in other cases, we will provide a level of moderate restraint where we are utilizing our body and our forearms to prevent forward movement as well as prevent our patients from flailing. Now, for some of our patients, more firm, balanced restraint is necessary. Some dogs actually feel better when you have them. You have a nice hold on them, preventing forward and lateral movement and prevention of flailing. And there's several techniques to utilize to help them both feel more comfortable and to keep you and your clinicians safe. So for larger dogs that we, for whatever reason, need them to be in lateral recumbency, that's an uncomfortable position for them. So it's important that we move them from standing to recumbency in one very smooth, gentle movement. So to do this, you want to make sure that your two handlers are aligned. So our hips are in line and our legs are lined up so that when we lean back, our knees sort of make a slide at the same time. And we'll want to make sure our patient backs up just a touch so that he's on the slide. We're going to take our inside arms and we're going to reach as proximally as we can, meaning as close to the body as we can, to that leg that is closest to us. And then our other hand can help gently move into position, being cautious not to pull on feet, where dogs are very sensitive about that. And it's going to be one swift movement where we lift up and then slide down. Good boy. And then Chelsea will move her forearm over the dog's neck and make sure she holds to the leg that's closest to the floor so that he is in a full restraint position. Now notice this dog is continuing to eat. His body language is relaxed and it's allowing for us to get him in this position, say for getting a urine sample through a urinary catheter, if there's some other neurologic or orthopedic exam that would need to be done in this position, we could do so